Well, this is Sky News and a somewhat shortened press preview, a first look at what is on the front pages. In the next 10 minutes or so, then we'll see what's making the headlines with the Observer's chief leader writer, Sonia Soda, and the political journalist, Isabel Oakeshott. So let's then check out the front pages, starting with the Metro. As the UK reaches 100,000 COVID-19 deaths, the Metro quotes the Prime Minister saying, "I'm deeply sorry for every life lost." The Telegraph has the same headline, picturing a downcast Boris Johnson. The Daily Mail, too, has a similar front page, "I am deeply sorry." And so, too, the Daily Express. The Eye carries the exact number of fatalities as a result of the virus, 100,162. The Sun declares, "We will remember them." The Guardian focuses on the questions the Prime Minister faced today over why the death toll is so high. The Times pictures 20 of those who lost their lives. Meanwhile, the Mirror launches an initiative to fund homeschooling, spurred on by a £1 million donation from a leading education union. And the Financial Times reports that in the first 3 weeks of the year alone, companies around the world have benefited from roughly £287 billion in post-pandemic government stimulus funds. So Sonia, Isabel are here with us, and a difficult day, and possibly the right tone, do you think, Sonia, that the Prime Minister managed to have today as he remembered those and said he was deeply sorry for every life lost, which makes many of the front pages?
Well, I think it's good that he apologised, but I think his words will have rung hollow for some people, because if you look at the pattern of deaths and when they've occurred, and of course we can all talk about the statistics, but I think one thing that's really good about tomorrow's front pages is that they've really sought to humanise the stories. So there's lots of pictures of people who've lost their lives on the front page, very much like, that really sort of hard to watch reporting that we've just seen at the top of the bulletin there. But if you look at where deaths fell, half of the deaths have been since early November, 50,000. So we've actually seen more deaths in the last kind of 3 to 4 months of this pandemic than we have in the whole first bit of it. And since January, we've seen a quarter of the deaths. And I think, it's good that the Prime Minister has apologised, but there are very, very serious questions for his government looking back. At the time, back in November, when we were in a national lockdown, experts were warning that if the government was too quick and too fast to lift the lid on social restrictions in December, back at that time we had the government saying we really want to loosen up for Christmas. We're going to try and make sure that everyone can have a normalish Christmas with people mixing. Experts were warning that that was going to feed through into death rates. Now, of course, the new variant has made things worse, but it's not just that. If you look at the number of deaths that we're seeing at the moment, scientists have been really clear today that we can trace some of that back to the loosening of restrictions that happened in December. So I think it's just a really horrible, grave moment for us as a country. We've got one of the worst death tolls in the world. We've reached this terrible, terrible milestone today. And I think we've got a government that hasn't really learned the lessons from the first half of this pandemic.
Well, the Eye there choosing to show some of those who have died. So too the Times, 100,000 deaths, the paper says. Boris Johnson said, "We did everything we could and we will continue to do everything we could." But is there a case to answer, do you think, about late decisions, as Keir Starmer pointed out, and as Sonia was saying there, Isabel?
Well, there's certainly a case to answer about many things. I'm not sure it's necessarily about late decisions, although late decisions certainly will come into it. I think Boris Johnson was right to hold the press conference that he did today. It makes almost all the front pages. Only the FT, as far as I've seen, and the Mirror don't go big on it tomorrow. And, Downing Street will absolutely have planned for the headline to be this very sobering image of Boris Johnson saying that he's sorry and taking personal responsibility. And if he hadn't done that, everybody would be baying for him to do so. So he's kind of preempted that. But I think that there is a danger that some of the reporting of this is excessively kind of mawkish. I mean, the human tragedy absolutely is there and it must be told. But at the same time, it's really important to remember that all 100,000 of these fatalities are not excess deaths. Many of these people are those who would sadly have passed away anyway because they were very elderly. So a lot of the reporting tomorrow's papers doesn't really put it in that context. It doesn't emphasize, and I think people need to know this, that the vast majority of those who died were actually very elderly and had comorbidities. So it's not as if the scale of this is as absolutely horrific as those bare figures make it look. Just having to remember the context of those fatalities, which is in no way to underestimate the absolutely awful loss of life and the very, very serious mistakes that were made. And I don't think that more lockdown, harder lockdown, continually keeping people locked up since last March would in any way have been the answer to this.
Go for it, Sonia. I know you want to come in.
If I just could come back on that, it's not true that these are people who are literally, people who've lost their lives to COVID, are people who are, literally on the point of death. That's just not true. If you look at the average years of life lost, for example, in terms of life expectancy to COVID, I don't know the exact figure off the top of my head, but it's several years. So it's just, and it's very hard to say to someone aged 75, well, who may have lost their 75-year-old partner, well, your partner may have had 10 more years, but sorry, like they're over the age of 70, so we can sort of write that off. Like it just isn't right to say that these are people who would have died anyway. These are people who, many of whom have lost significant amounts of life, years of life. That's incredibly distressing. It's incredibly distressing to their families. Nobody is saying that we could have had 0 deaths from this pandemic, but I think it's important to go back to the start where scientists were saying, 20,000 would have been a good number. Lots of countries have struggled to manage this, but the fact of the matter is we're a rich country with an excellent healthcare system, centralised healthcare system, and we have suffered one of the worst death tolls in the world. That is incredibly grave and serious, and we shouldn't be underplaying it.
Yes, I think 11 years was the average estimated expected life expectancy beyond the death, and that was towards the end of the first day. But it's changed now. This variant, Isabel, has made younger people suffer more deeply, haven't they? And I've been told by a friend of mine who's an ICU consultant, the average age in now is 40s and 50s, and people are iller, and some people have simply just minutely elevated blood pressure as their underlying. So that is the difficulty now, that it is changing, and we heard that certainly from Chris Whitty and Stevens today as well, that actually the variant is making a lot of difference to how this proceeds.
So there's no doubt that the variant has created big new challenges, absolutely, undoubtedly. But I want to take you up on that figure that you just wheeled out there about the average loss of years being 11. I don't think that has been independently verified, 10 or 11. I would suggest a degree of caution about that. Additionally, it is worth remembering 88% of deaths have still been of those aged 70 plus. So, unfortunately, yes, sadly, there are younger cases, and in no way should we be complacent about this. But the majority, indeed the vast majority of people are older, which doesn't mean to say that their lives don't count or that terrible, terrible mistakes haven't been made. I mean, for example, why did the government decommission those amazing Nightingale centres that they built so brilliantly in the first wave? Because they didn't think that there was going to be a second wave of this scale, and that was a huge resource.
Because they couldn't staff them, and because COVID is a multi-organ illness, and it was set up for a respiratory illness, and therefore could not cope with the multitude of problems that people were facing. I think that was also another of the reasons. Let's just see the Daily Telegraph. I'm deeply sorry for every life lost. Again, The Guardian, I'm deeply sorry. The Prime Minister faces questions over the death toll. We're running out of time. Just a quick 10 seconds, Sonia, just to conclude.
Just wanted to pick out one of the stats on the front page of the Telegraph, which is that people in the very poorest areas, their death rates are 6 times higher than in the wealthiest areas. It's a really stark illustration of the inequality in this pandemic, and the fact that it's a disgrace that we're not making it financially possible for low-paid people who don't qualify for proper sick pay to self-isolate at home.
Sonia, Isabel, lovely to see you both. Thank you. We'll see you for more longer at 11:30. So Sonia Soda, Isabel Oakeshott are here. The figure writ large in two of the newspapers, The Eye and The Times, more than 100,000 lives lost. Isabel, you kick off then.
Yeah, so almost all tomorrow's papers focus heavily on that awful milestone of 100,000 deaths linked or associated to coronavirus. And the Prime Minister's sobering words and that image, very powerful image of the Prime Minister saying that he is deeply sorry for all those losses and taking responsibility. And I think Downing Street was right to do that press conference. I think that if Boris Johnson had not said sorry, then the next few days would have been dominated by headlines about why hasn't he, and he needs to express those sentiments. But it does lead for some very, very bleak coverage in all the papers tomorrow. And I am concerned that the reporting doesn't, a lot of it, give a lot of the perspective here in terms of the average age of those who have died, the fact that the vast majority of those who have sadly lost their lives did have comorbidities, and in many cases, generally very high number of those also had weight issues. That is not to say, of course, that they're not real tragedies, each and every one, but people perhaps should not be so terribly frightened by those figures as on the face of it, the stark figures suggest. Many of those people, unfortunately, would have passed away this winter anyway. Not at all of them. There are excess deaths here, of course.
And yet, even today, the head of NHS England, Sir Simon Stevens, said a quarter of hospital admissions are now for people under the age of 55, and half of inpatient critical care bed days relate to people under the age of 65. Obviously, the much older don't get into ICU, do they, because of survivability issues? But certainly, anecdotally at least, it does appear that younger people are becoming more seriously ill because of the variant, Sonia. But much of this relates to the first wave, the 100,000. Your thoughts then?
Well, I think it's just not true to claim, as Isabel has, that many of these people, the 100,000 who tragically lost their lives, just to help people visualise the scale of this awful national tragedy, that's more than enough people to fill Wembley Stadium. And it's just not true to say that lots of people would have lost their lives this winter anyway. If you look at the analysis on the average life expectancy lost, very robust analysis shows that for men, it's 13 years for men who die from COVID. For women, it's 11 years. Those are huge kind of, that's years that people could have had with their family, with their loved ones, with their friends. So I think to try and sort of minimise that is to really minimise the scale of the human tragedy that we're facing here. And I think, with this number of people who've lost their lives, we all know people who've, friends who've lost parents, who've lost relatives, for example. And I just don't think we should be minimising the scale of this. I think, there are really serious questions facing the government. Sure, Boris Johnson apologised. It's hard to know what else he could have done, but he didn't show much contrition. He didn't show much evidence of having learned from the mistakes. And I think if you look back over the last year, the government made a series of mistakes back in March, April, lockdown too late. It was too slow to take tough decisions. Some of those mistakes have been exactly replicated this time round. We waited too late to impose social restrictions. No one likes social restrictions, but with a virus that grows exponentially, you do need to impose them once infections are getting out of control. Otherwise, you see daily death tolls of the scale that we're seeing at the moment. The government didn't do that. It relaxed restrictions in December, even when we knew there was a new, more infectious variant in mid-December. Another serious issue in this lockdown is many more people are going to work, particularly low-paid people. That there is pressure on them from employers to still continue going into work. And that's why we see in the most deprived areas, the death rate is 6 times that in the wealthiest areas. And I think it just illustrates the scale of social inequality and the scale in government failings to protect people from less affluent households from this pandemic.
The Daily Express then, I'm deeply sorry for every life lost, their front page there, and the Telegraph too with a bowed head. I am deeply sorry for every life that has been lost, as well as the sombre tone and the apology then, Isabel. He did say, I take every responsibility, but he also said, we did everything we could and we will continue to do everything we could. Did there need to be more acknowledgement, do you think, at least of the criticisms levelled at the government, as Sir Keir Starmer said later on, about the delays in action, possibly?
Well, it's an almighty big deal for a Prime Minister to stand in front of the nation and make that kind of quite humiliating apology, in a way, to the nation. And Sonia's right, you know, he had to do it. But I don't think today was the day to go further and list all the mistakes that have been made. Otherwise, it would have reached 100,000 mistakes, as well as 100,000 and more lives lost. That will all come out in due course. We know some of the mistakes already are very obvious. For example, failing to maximise the potential of those fantastic Nightingale centres that were built. Unfortunately, they didn't have enough staff to actually use the Nightingale centres properly. But why haven't they made the most of all those amazing people who volunteered, formerly people from the health service, professionals who are ready to come back and look after those who were sick? The Nightingale centres could have been used for many other things in order to ease pressure on the NHS. But unlike Sonia, I don't think that more lockdown is the answer to what's happened. There's actually surprisingly little correlation between countries that have had the hardest lockdown and countries with lower mortality rates. In many cases, countries with the harshest lockdowns have had among the highest mortality rates. So it's not an answer. We could, of course, kept everybody locked up since last March. And for how much longer would that be? Until every single person is vaccinated? I don't think that was ever a viable option. I don't think the government went fast and loose in December. I don't know anybody who had any kind of normal December. Things were pretty locked down and have been for much of the past 10 months.
Yes, I'm afraid I don't necessarily accept that that correlates. If you let the virus enter your country, you're very likely to end up with the harshest lockdown and the largest mortality. And you could argue that is what happened in the UK as we debate borders, which I know we're going to do later. Many suggested that's what should have happened last year. Difficult for the UK, which is a hub, obviously. Down the bottom of the Daily Telegraph, I'm not sure we can see it, one point which is an important element to note with all of these deaths. The victims of COVID suffered and died alone. They deserve to be remembered. And that does mean that all their relatives couldn't see them, don't feel like they've gone in some respects, and will have mental health issues because of this sort of vacuum in their lives, which sort of came from nowhere, people waving people off in ambulances. This is a significant element, I think, also that society needs to recognise, don't you, Sonia?
I completely agree, Anna, and I think we're yet to sort of recognise the scale of the trauma that this has imposed on all of us, particularly people who have lost loved ones. It's a really awful thing not to be with your relative when they're sort of, you know, when they're about to pass away. We know lots of sort of, you know, in hospitals, you know, people have been getting really sort of humane care from nurses and doctors who've done all they can to sort of make people as comfortable as possible and to provide company. But it's just, I mean, it's just so distressing to think about. And when you listen to the accounts of people who've lost relatives and they weren't able to be there, they weren't able to say bye to them, I do think that really leaves a mark. And I think it raises a big question for government about the funding of bereavement services, for mental health services. We know that mental health has been underfunded in this country for a long time. We know that there's going to be lots of people who've suffered bereavement in the most terrible of conditions. And as your report on Sky said tonight, families who've lost not one, not two, but sometimes three members of an immediate family or a close family. It's just so dreadful. And I think we are going to be living with the long-term impacts of that trauma for a long time yet. And I think it's hard to sort of process it and in the moment, the scale of what we as a society have gone through.
And as we look at the picture on the front page of The Guardian, with the Prime Minister with his head bowed, we don't normally have sympathy for them, but it's hard for politicians too. Here's a man who thought he was going to deliver a brilliant Brexit for people, and yet he's facing this pandemic. I mean, you know, so you might say that's not the job he signed up for. How hard is it, do you think, for every day the politicians and the chief medical officers and the scientific advisors to dig deep and get through all of this, Isabel?
Well, I think it's absolutely horrific. I mean, yes, it's the job they signed up to do, because when you sign up to become Prime Minister, you sign up for whatever fate throws at you. But, absolutely, somebody like Matt Hancock has been working flat out, day in, day out, since the beginning of this pandemic. He must be absolutely exhausted, and yet he still manages to put on a brave face on what must be just the most horrific experience for him and for many others in the cabinet that are leading the drive on this. And, yes, on a human level, well done them, but that is their job. And what they're going through is, in many ways, no worse to what many ordinary people up and down the country are going through as they struggle to make sense of this. And this virus has left nobody untouched, whether it's parents who are desperately trying to manage everything and homeschool their children, or, as Sonia said, people were unable to say goodbye to their loved ones in their final hours. Really just an awful situation for everybody.
And the main thrust of the Guardian article, of course, is the questions that remain over this death toll. No doubt there will be at least one, if not more, public inquiries about this as they dig into the preparedness in terms of PPE, the messaging, the training over flu rather than a coronavirus. It goes on, doesn't it? The list of timing. I mean, there are so many questions about what could or should or might have been done to limit the numbers who died.
That's totally right. And I think just as important as a public inquiry when all this is over, and I think that will be really important in terms of shaping our preparedness for future events like this. But it's really, really important that governments learn in real time as well. Nobody expects a government to get every aspect of their response to a massive, catastrophic event like this right. But this government has proved time and time again, it doesn't learn from its mistakes. It makes the same mistakes over and over. Still now, there are scientists pleading with the government saying, please make it financially possible for people who have symptoms to self-isolate and stay at home. There are still too many people who they can't stay at home because they don't have any money. They can't pay their rent. They can't put food on their table for kids. There are still things that the government is doing that are increasing our risks from this virus that it could be doing differently. We're going to come on to talk about borders, I think, in a minute as well. So yes, there will be a time for an inquiry, but this government is not learning from its mistakes in real time. These things have been highlighted time and time again. And yes, it's a tough job. Yes, we feel sympathy for ministers, but at the end of the day, if you're not up to the job, this is too important, you should stand down. Boris Johnson is not a man up to this job. That has been patently obvious for months.